Well, thank you. My name's John Points and I'm an independent consultant on food contaminant and authenticity testing based in the UK. And today I'd like to give you a bit of a background to how veterinary medicines are authorised, controlled and administered, how limits are set for residues in food, how regulatory authorities organise surveillance testing to ensure these limits are met, and how this testing is delivered. I'd like to draw out some regional differences, particularly between the European Union and other regions of the world. And finally, give a quick overview of the commercial landscape. This should take about 20 to 25 minutes. So I have to start with why the world needs veterinary medicines at all. They're essential for animal welfare and husbandry. They can be used to treat disease, such as the picture of the cow with mastitis, an extremely common problem with dairy cattle, or to prevent disease. With large populations of animals in relatively close proximity, such as poultry sheds or fish ponds, once an outbreak of disease is diagnosed, it's too late. Medicines are used prophylactically. Animals can also suffer from stress and pain, for example when being transported. And finally, and more contentiously, drugs can be used to improve yields. Growth promoters are banned within the European Union, but in other parts of the world they're seen as good husbandry, a perfectly sensible way to increase your meat yield, in the same way that you would control an animal's diet. You can either treat an individual animal, or, in the case of sheep dips, flocks of poultry, or ponds of fish, give it to the whole flock. In the latter case, it's usually added to the feed or to the drinking water. Each individual medicinal product has to be given a license by each national authority in each country it's sold, in much the same way that human medicines are licensed. So each license only applies to one specific product, and only for use for the animal species listed in the application. So you can see here an example of a UK authorization, and you can see, if you squint hard enough at the screen, that it is for a doxycycline powder, an antibiotic, to be added to drinking water for either pigs, for chickens, or for turkeys. And as well as the typical things that are assessed for a human medicine, like effectiveness and safety, for veterinary medicines, the licensing authority also has to consider the safety of residues in food. They do this on the basis of a risk assessment by an expert advisory committee. Now, there are many different risk assessment institutes in many different countries. In the European Union, it's all centralised through the European Medicines Agency, or the Committee for Veterinary Medicinal Products, as was. So in this case, the licensing authority can look back and see that, yes, doxycycline has been assessed. Now, you would probably guess that, as veterinary drugs are, at the end of the day, medicines, they're unlikely to be acutely toxic. But the assessors need to consider long-term effects, like genotoxicity or effect on the gut microflora. They work out the level that has no observable effect, and then, building in lots of safety factors, an acceptable daily intake. So the acceptable daily intake, or ADI, is the amount an adult could eat each and every day of their lives without any effect. The assessors then use a worst-case portion size estimate to calculate a maximum residue limit in food. So maximum residue limits, or MRLs, are safety limits, calculated backwards from the ADI. This is an important difference to pesticides, where the MRLs are the maximum that should be left if the product is used properly. So these MRLs are then enacted into national legislation, or in the case of the European Union, into Commission legislation. So, for doxycycline, there's a limit of 100 micrograms per kilogram in poultry muscle. Then, going back to the licensing application, the regulatory authority specifies a withdrawal period. So in this case, for chickens, you must stop administering this product at least 5 days before slaughter, and this is part of the licensing conditions. This should ensure that residues in the meat have fallen to below the MRL. However, any of you who've ever talked to a toxicologist will know that two of them can look at the same data and come to different conclusions. So what is to stop different national risk assessors recommending different MRLs, then one country refusing to buy another country's meat because they say it isn't safe? Well, nothing. And it does happen. But there is a mechanism for harmonization. The Codex Alimentarius Commission was set up in 1963, and one of its major remits is to advise on MRLs. National governments can still overrule this advice, but they have to have a good scientific reason for doing so. If there is a World Trade Organization dispute, then they will look to Codex standards as a starting point. In fact, the Sanitary and Phytosanitary Trade Agreement, which is the one that covers residues in meat, specifically references Codex. The Codex Committee that covers veterinary drugs has been working for over 30 years. As well as recommending MRLs, they have published a very detailed code of practice. Again, it can only be recommendations, but it covers the licensing, distribution of medicines, how to design national sampling and testing plans to check that MRLs are not being exceeded, and laboratory test methods and quality control. So has the harmonization worked? Well, yes, mainly, but there is one glaring exception: steroids and growth promoters. This one has been parked by the World Trade Organization for so many years that it's a permanent feature of the car park. As I said earlier, the European Union have banned all growth promoters and will not accept food where they have been used. But Codex have assessed some and recommended MRLs. Not only that, for some hormones, they have said that the residue you get from drug use is so negligible compared to the natural variation in the animal that there's no need to even set an MRL. So the EU say that their ban is on the grounds of science. The US maintain that it's on the grounds of consumer acceptability, which would not be allowed. And there we are. And there we stay. In the case of other medicines that have had historical use, but have been reassessed, found cause for concern and withdrawn, the EU and Codex are largely in agreement. This does not prevent them being approved, but the importing country, for example the EU, can say that we will not accept any residues. That is why there's so much pre-export testing for things like nitrofurans and chloramphenicol in China and Southeast Asia. Just to finish on the authorization process, I will mention the big gap, within the EU at least, uses that are called biocides. So to illustrate, if a substance is used as a pesticide, it has a risk assessment, an approval process, and limits are set in food. If the same substance is used as a veterinary drug, again, there's an approval process and residue limits are set in food. But if it's used as a disinfectant, say on the animal sheds, then there is no approval process at the moment. And because no limits have been set, then any residues in food are unacceptable. And this can lead to obvious inconsistencies. This year's fipronil scare was a little different because they weren't even using the product legally. But there are things, such as the perfectly legal use of benzyl ammonium chloride disinfectants, which then breach the pesticide MRLs. So if the EU imports meat, fish, milk, eggs or honey, then they have quite stringent conditions on residue controls. The exporting country must not use growth promoters or must operate a split production, effectively ring-fenced EU production, which operates to EU rules and which is subject to audit and approval by the Food and Veterinary Office of the Commission. This has to include a surveillance plan, which is equivalent to an EU type scheme. And this plan has to be submitted to the FEO and approved. All surveillance results have to be submitted to the FEO every year. The surveillance testing plan has to include all of the EU listed substance groups. Laboratory method validation has to be equivalent to that prescribed in the EU. And the laboratories themselves are also subject to audit by the FEO. So the requirement for a surveillance scheme, in some form or other, is not unique. Every country must have some form of surveillance testing scheme to check that authorizations are working as envisaged and MRLs are not being breached. But in the EU, residue surveillance schemes have a very prescriptive format. Every member state has to operate one. The residues that need to be included are all listed out, as are the number of samples to test. To draw an analogy with sports anti-doping testing, most of the samples are taken during competition. In this case, this would be at primary production, when the animal is slaughtered or milked. But some samples also have to be taken during training or out of competition, or the analogy here is on the farm, an unannounced visit, and it's usually a urine or a blood sample from the animal. Unfortunately, I can't think of a sporting analogy for the final category. This is if there's an obvious suspicion. If an animal staggers into the slaughterhouse with a needle hanging out of its leg or is clearly ill, then samples always need to be taken. The residues that have to be included are all listed in the legislation. So I don't know if anybody recognises this list, but this is why reference materials companies very sensibly mirror the format of the EU list in their catalogues. This is the LGC standards catalogue. So that any lab doing EU regulatory testing can easily see that you can supply the whole list as a one-stop shop. Now, a big difference between EU residue testing schemes and codex comes in the number of samples to be tested. In the case of codex, the testing is a statistical sampling exercise. The number of samples is capped, regardless of how big the industry. So typically, this might be 300 samples a year. So, for example, for the US cattle industry, this would be a relatively small proportion. In the EU, samples have to be taken pro rata on the size of the industry. The testing is designed for policing and deterrence, as well as just statistical information gathering. Any country that exports to the EU must operate an EU-style scheme, at least for their ring-fenced export production. In actual fact, many smaller industries, and some larger ones, such as Chile's pork and poultry industry, choose to operate an EU-style scheme across their whole national industry for the sake of simplicity. But you can see the difference in scale, even for a relatively small country like the UK. And this is why there's so much emphasis on EU testing requirements and analyte lists. In terms of the global testing market, it accounts for the vast bulk of the samples taken and tests delivered, especially if you add in the enormous amount of pre-export testing that is done in places like Southeast Asia. The last thing I'd like to talk about is laboratory criteria for regulatory testing. There are some quite specific requirements on laboratory methods and quality control. Now, most laboratories use a two-stage testing process, screening and then confirmation analysis. Screening is just saying whether residues are above or below a reference measurement, usually set at half of the MRL. So whatever test method you use, you need that half MRL reference for every analyte on the list. That's where the big list of reference standards comes in. If you're using LCMS, then he also needs some representative isotopic internal standards. Any screen positive sample then goes on for confirmation. Most laboratories these days use some flavour of LC-MS. So they need a more extensive calibration range, but only of a residue they're looking for. But if at all possible, they really need that stable isotope internal standard for quantification. In terms of method validation, the big difference between the EU and Codex is that in the EU, the method validation criteria are set in primary law. It's not just guidelines. It is quite prescriptive, and although exporting countries do not have to follow the EU protocol precisely, they do have to demonstrate equivalence. Lots of countries have decided that the easiest way to do this is just to adopt the protocol. Labs supporting export to the EU are subject to audit by the European Food and Veterinary Office. I've been both audited and an auditor and can verify that these can be quite stressful. But if they also export to the US, they're also subject to audit by the US Department of Agriculture. The USDA have slightly different criteria, but if a lab has used an EU-style validation protocol, then this will also satisfy the Codex guidelines. There are not really that many differences in method validation requirements, as you would hope not, remembering that the EU is actually a member of Codex. The US have traditionally given more of an emphasis to the use of standard methods, but this is changing. They have some particular requirements, such as liking to see control samples that are blind to the analyst, and seeing proficiency test results trended by analyst as well as by method. The US uniquely also require that arsenic is included in heavy metal tests. This is because in years past, some arsenic compounds had veterinary drug approval in America. The EU has a more prescriptive approach to method validation, but generally gives a much greater emphasis to checking that all of the listed analytes are included in the test methods and have been validated at the required detection levels. In terms of the number of labs out there, these could be split into regulatory and private labs. Europe has got an extensive network of regulatory labs. At the top of the tree are 3 reference laboratories. Their role includes ensuring that appropriate test methods are used, running proficiency testing schemes, and, interestingly, providing reference standards, although they do very little of this in practice. If a standard is commercially available, they will just point people towards the commercial vendors and only step in to provide standards that are difficult to obtain. The number of regulatory laboratories then varies by country. In Germany, there is at least 1 in every Länder. In Britain, there is just 1 centralised laboratory. For example, Malta's industry is so small that it outsources all of its veterinary residues testing and its national reference laboratory functions. So that's Europe. In China, as I mentioned, there's a huge amount of pre-export testing, which is centred in the provincial Entry-Export Inspection Bureau laboratories in the big coastal cities. For example, Guangzhou and Qingdao have extremely busy laboratories. There is also a Ministry of Agriculture network of laboratories that service the residue testing plan for domestic consumption, with a Ministry of Agriculture laboratory in every province. In America, the USDA can contract testing to accredited private laboratories, or they can use their own labs. At the risk of offending all of the other USDA research centres, there are some recognised centres of expertise, notably in Colorado and Pennsylvania, where they will work on methods to roll out across the network. Now, I did say that I would include testing by the food industry itself rather than regulators, but the truth is that demand is relatively small. relatively compared to pesticide residues, that is. There are a few laboratories in Europe offering private sector testing, particularly in Italy. The bulk of the private work probably goes to the Eurofins laboratory in Hamburg. Notable exceptions to this are the big multinationals, where there have been previous trade issues or where there's a clear potential reputational risk. Cargill and Nestlé, for example, have their own labs. In fact, Sun Valley Chicken, part of Cargill, was probably the biggest purchaser of LC-MS instruments in Thailand in the mid to late 2000s. So, I hope this has given you an overview of veterinary residues in food and why people need reference standards.